This is Diana Wind. I'm here to present my systematic review for APN 760, and it's on the effect of oral B12 vitamin supplementation on diabetic neuropathy pain. Today's overview will include the introduction, vitamin B12, my research question, methodology, the research findings from the 4 studies, discussion and implication of the findings. I'd like to start with a brief introduction. The most prevalent chronic microvascular complications in diabetes are diabetic neuropathies. Diabetic neuropathic pain feels like burning, tingling, or shooting pain, and it can get worse in the evenings. Diabetic neuropathy pain is often felt in the legs, feet, and hands, and pain, as you can imagine, can have a significant impact on the quality of life. The American Diabetes Association suggests clinicians evaluate other possible causes of neuropathy symptoms before diagnosis. For example, serum B12, folic acid, thiamine lab testing can be helpful. And prevalence of vitamin B12 deficiency is greater than 50% in people with type 2 diabetes. B12 is also known as cobalamin. It's found in animal foods and fortified nutritional yeast products. It's a water-soluble vitamin. Symptoms of B12 deficiency include tongue glossitis, fatigue, heart palpitations, pale skin, infertility, weight loss, and numbness and tingling in the hands and feet. Tingling and numbness in the extremities are very similar to symptoms of diabetic neuropathy. B12 is needed for the nervous system, formation of red blood cells, hormone production, and synthesis of DNA, as I previously mentioned. There are a few medications that can also interfere with the absorption of vitamin B12, such as metformin, which is the first line of defense. It's often prescribed for diabetics. Medications for GERD or peptic ulcers can also interfere by slowing the release of gastric acid into the stomach, which can lead to a vitamin B12 deficiency. B12 deficiency can cause megaloblastic anemia with abnormally large red blood cells, and also an autoimmune disease called pernicious anemia that affects the parietal stomach cells. They fail to make intrinsic factor, and that can lead to malabsorption of vitamin B12. I wanted to include this slide on vitamin B12 for the RDA, so you could see it increases as one gets older. So babies up to 6 months only need 0.4 micrograms of vitamin B12. Babies 7 to 12 months old, 0.5 micrograms. 1 to 3 years old, 0.9 micrograms. 4 to 8 years old, 1.2 micrograms, and age 9 to 13, 1.8 micrograms, and age 14 and older, 2.4 micrograms. And you can see it even goes a little bit higher for those that are pregnant or lactating. And the studies that we'll be talking about do not include any pregnant women, and it does include adults, men and women, age 18 and older. So you'll see a significant difference in the dosing of the B12 used in the studies compared to the RDA, and the studies use much higher doses, 750 micrograms to 2,000 micrograms are used in the studies that we'll be talking about. And it's interesting to know that the body does store B12. About 1 to 5 milligrams can be stored, which is about 1,000 to 2,000 times more than the amount we typically consume in our daily diet. And B12 deficiency signs and symptoms can take several years to show. My PICO research question is, among adults over age 18 with controlled type 2 diabetes mellitus, what is the effect of oral B12 methylcobalamin vitamin supplementation on diabetic neuropathy pain? I used a search and selection strategy that used key search terms. I searched two databases, PubMed Central and CINAHL. I came up with 255 articles. I screened 255. I excluded 247, and I had 8 that were assessed for eligibility. I excluded 4 with reasons that I will write about in my manuscript. If you're interested in reading the manuscript, it will be available. And I'll tell you on the next 2 slides what the inclusion and the exclusion criteria was. I used a search and selection. The inclusion criteria for this systematic review was men and women that are adults over age 18 with type 2 diabetes and diabetic neuropathy in an outpatient ambulatory care setting. It could have been a randomized control trial or an experimental study. Had to be human research only, not animal research, and with less than 20% dropout rate during the time period of 2011 to the current 2022, and with B12 as in the intervention in the form of methylcobalamin, either in a nasal spray, intramuscular shot, oral dietary supplement, or in a B medicine blend containing methylcobalamin. The exclusion criteria for this study was if they were under age 18, if they were inpatient, hospitalized, or in acute care, if they were pregnant, if they were alcoholics, if they had kidney failure or had weight loss surgery. And other considerations for exclusion were if their diabetes was not controlled, if their A1C was greater than 11%. And also, as far as the dropout rate, if it was greater than 20, those studies were excluded. If they were before 2011, they were excluded. And also, articles that were not published in English were excluded. The 4 studies for systematic review included the following: DeDangelos T. et al. In 2021, vitamin B12 supplementation in diabetic neuropathy, Tripe B.S. et al. From 2016, using the vitamin B blend called L-methylfolate methylcobalamin pyridoxal 5-phosphate. Fonseca V.A. et al. 2013, using the same L-methylfolate, methylcobalamin, pyridoxal 5-phosphate, vitamin B blend, also called Metanex, in type 2 diabetes with peripheral neuropathy. And the fourth study was Vasudevan D et al. In 2014 on the efficacy and safety of methylcobalamin, alpha-lipoic acid, and pregabalin combination versus pregabalin alone as a monotherapy. Pregabalin is an FDA-approved treatment for pain, and so is duloxetine. But you'll see pregabalin often used. So that particular study did include that pain medicine in the study as well. We're going to start off with a quick review of the research findings from DeDangelos T et al. On vitamin B12 supplementation and diabetic neuropathy, a 1-year randomized, double-blind, placebo-controlled trial published in Nutrients in 2021. So in this study, it was held in Greece. Their inclusion criteria met the criteria. The greater than age 18 individuals had diabetic neuropathy. They were randomized to a treatment group, N equals 44, and they received an oral dose of 1,000 micrograms of B12 methylcobalamin, and the control group had a placebo, N equals 46. The mean age was 63, and there was pretty even division of men and women in both groups. They used for statistical data, ANCOVA, general linear regression was used, and that was adjusted for their A1Cs, which were between 6.5 and 7.5. They used a questionnaire called the Michigan Neuropathy Screening Instrument, and that was used with the MNSIE, which is the Michigan Neuropathy Screening Instrument Examination. So there was a questionnaire and an examination form, and that evaluated the quality of life and the level of pain. So their outcomes showed that B12 levels significantly increased in the treatment group, which wasn't a surprise, and that there was no significant change in the placebo group. But what they also found was that the pain level significantly decreased by 7% in the treatment group, and that showed improvements in neurophysiological parameters, motor function, pain score, and quality of life. The next study was by Tripp B.S. et al. Nutritional management of patients with diabetic peripheral neuropathy with L-methylfolate, methylcobalamin, pyridoxal 5-phosphate. Results of a real-world patient experience trial published in Current Medical Research and Opinion in 2016. The next study In this study, it was conducted in the USA. The researchers wanted to explore the underlying pathology of diabetic neuropathy rather than just treatments with pain medication. It was a non-randomized control trial using the vitamin B blend called Metanex. They had a good number of participants. They had 544 participants who completed a survey study. And that included, they all had to have the presence of diabetic neuropathy symptoms, which was assessed by a modified 6-item neuropathy total symptom score called NTSS6. And that questionnaire was used in this study. The overall pain rating was measured using a 10-point scale, with 0 indicating no pain and 10 indicating the worst possible pain. They were 12 weeks on the oral vitamin B blend. And the outcomes of this study were that the mean baseline was slightly more than half of patients reporting the NTSS6 score of 5 or 6. Overall severity of pain was significantly reduced after the vitamin B blend from a mean score of 5.8 at baseline to 4.0 at follow-up. The individual's neuropathy sensory symptoms that make up the questionnaire were statistically significant, with p less than 0.001. Reductions from baseline were observed across all 6 items with the vitamin B blend treatment. And on the next slide, I'll show you one of the graphs from the study. And the patients self-reported quality of life statistics of if their lives were disrupted from pain in different activities, and that also showed improvement in those that took the vitamin B blend. This is a graph that was in Trip BS et al. Study, and it was a nice a graph I wanted to include in this presentation, so you can see that they had 6 different descriptions for signs of neuropathic symptoms. One was deep aching pain, burning pain, which you can see in the graph. They had the largest improvements from baseline to the follow-up, and other things assessed were prickly feeling, numbness, lacinating pain, or allodynia. And allodynia is a type of neuropathic nerve pain, and people with allodynia are extremely sensitive to the touch. So, so all of the results, and when asked, you can see there was improvements, statistically significant improvements, as shown in this graph. Another interesting research article by Fonseca V.A. et al. Metanex in type 2 diabetes with peripheral neuropathy, a randomized trial, published in American Journal of Medicine 2013. This study was conducted in the US, and they did a randomized double-blind placebo-controlled trial. They studied whether the blend of B vitamins in the Metanex improved sensory neuropathy. They screened 373 patients, 214 entered the study, and 200 completed it. The patients were randomly assigned to either the treatment group or the placebo group. The patients receiving the treatment group reported pain relief with clinically significant improvements in their NTSS6 scores. The NTSS6 is a questionnaire similar to what Tripe et al. Used in their study, and it's a neuropathy total symptom score 6 sheet. And the effect of the B vitamin blend on the symptoms of diabetic neuropathy was statistically and clinically significant. The fourth study that was systematically reviewed was research by Vasudevin D. et al. Efficacy and safety of methylcobalamin, alpha-lipoic acid, and pregabalin combination versus pregabalin monotherapy in improving pain and nerve conduction velocity in type 2 diabetes associated impaired peripheral neuropathic condition. Maintain. Annals of Indian Academy of Neurology is where it was published in 2014. This study was conducted in India. It was a randomized controlled pilot study for 12 weeks using an small group. It was 30 adults divided evenly into two groups. The treatment group that had the pain med, pregabalin, plus the vitamin B blend, and then another group that was just with the pain medication. They wanted to see if the B vitamins made any difference for pain relief of the diabetic neuropathy. They all had pain for greater than 6 months before starting the study, and they had at least completed 1 daily pain diaries during the screening phase that reported an average daily pain score of 4 on up to 11 numerical point rating scale. Significant improvement was seen in both groups, and the methylcobalamin with the pregabalin combination does provide pain relief according to their study. Slide shows a visual abstract of the 4 studies. You can see the population, male, female, greater than age 18 with controlled type 2 diabetes and diabetic neuropathy, or also called peripheral neuropathy. 2 of the studies were randomized control trials, one in the United States, one in Greece. One was the randomized control pilot in India, and the other was non-randomized in the US. Total N from all the studies was 664. And in review of the interventions, you could see the time frame went from 12 weeks in study 2 and 4, and 1 year in study 1, and 24 weeks in study 3. The interventions all had vitamin B12 in them, and interventions 2 and 3 had the vitamin B12 within the blend, the food blend of B vitamins. In the outcomes, one of the trials found improved neurophysiological parameters and swatomotor function, but all of the studies found that B12 or B vitamin supplementation, especially oral B12 methylcobalamin supplementation, significantly reduced pain and improved the quality of life. In conclusion, you can see that studies 1, 2, 3, and 4 all showed reduction in pain and improved quality of life. And in summary, among women and men over the age of 18 with type 2 diabetes and peripheral neuropathy, oral B12, vitamin B12 methylcobalamin dietary supplementation between 750 and 2,000 micrograms a day for 12 weeks to 1 year significantly improves quality of life and helps to reduce diabetic neuropathy pain. So in this study, some of the strengths and weaknesses included, for example, a strength was that all these studies used oral B12 methylcobalamin in their interventions. No one used a B12 shot or any other type of B12. So the methylcobalamin is one that is often used in the dietary supplements. And another benefit, strength was the benefits for improved quality of life and less pain was noted in all of the studies. So that suggests a possible alternative treatment for diabetic peripheral neuropathy. And the doses were 750 to 2,000, so all the doses were high. So I would see that as a strength, that they were consistent in that manner. And the weaknesses were that 2 of the studies did use the B12 food blend, and they had other ingredients, so we don't know for sure if some of those other ingredients were strong contributors for the improvements, or was it just the B12. And all of the studies were less than 1 year, so I see that as a weakness. Would the results be the same in studies longer than a year? Would they still improve the quality of life and the pain threshold after 1 year? Well, this about wraps up my systematic review. On a final note, I'd like to just mention some implications for research and practice. And diabetic neuropathy is one of the most common microvascular complications of diabetes, and finding additional treatments will be helpful to those with diabetic neuropathy. And oral B12 methylcobalamin shows promising benefits to improve quality of life and for pain relief from type 2 diabetes neuropathy pain. With increasing cases of type 2 diabetes worldwide, this has great implications for future research. And all 4 studies suggest a possible alternative treatment for diabetic neuropathy pain. And that will conclude our session for this systematic review. And I thank you again for your time and all the best in your research. And I look forward to hearing your feedback.